Nelarabine 250 mg per 50 ml intravenous solution. Purine Analogues is a medication used for treating specific types of cancers like leukemia and lymphoma. It is a chemotherapy drug that works by slowing down or halting the growth of cancer cells. Before using Nelarabine, make sure to read the patient information leaflet from your pharmacist. This medication is given through a slow injection into a vein by a healthcare professional. The treatment period is called a cycle, and in adults, it is usually given on days 1, 3, and 5 of each cycle. In children, it is usually given daily for 5 days in a row during each cycle. The dosage is based on your medical condition, age, body size, and response to treatment, and your doctor will check your blood counts to make sure you can receive your next cycle. Keep all medical and lab appointments. Some common side effects of Nelarabine 250 mg per 50 ml intravenous solution may include headache, nausea, vomiting, loss of appetite, constipation, diarrhea, cough, shortness of breath, dizziness, drowsiness, and tiredness. Your doctor may prescribe medication to help with nausea and vomiting, and eating small meals or limiting activity may also help. It's important to let your doctor know if any of these side effects become severe. There are some serious side effects that can occur with this medication, but your doctor has prescribed it because they believe the benefits outweigh the risks. Your doctor will monitor you closely to minimize the risk of serious side effects. If you experience symptoms such as easy bruising or bleeding, swelling in the ankles or feet, signs of infection, or kidney problems, be sure to contact your doctor right away. In rare cases, Nelarabine can cause a serious allergic reaction. If you have symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so it's always best to talk to your doctor if you have any concerns. If you experience any side effects, be sure to contact your doctor for medical advice. Serious nervous system problems may rarely occur with the use of Nelarabine 250 mg per 50 ml intravenous solution. The risk may be higher if you have previously had chemotherapy injection into a certain part of the spine or radiation treatment to the head or spine area. Contact your doctor immediately if you notice any symptoms of nervous system problems such as extreme sleepiness, confusion, numbness or tingling in hands or feet, loss of coordination, muscle weakness, or unsteadiness while walking. Seek medical help immediately if you experience paralysis or a seizure. These symptoms may not completely go away even after stopping treatment with Nelarabine. Be sure to consult your doctor for more information. Before using Nelarabine, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Let your doctor or pharmacist know about your medical history, especially if you have blood/bleeding disorders, kidney problems, liver disease, numbness/tingling in hands/feet, or a history of seizures. Nelarabine can increase your risk of getting infections or make current infections worse, so try to avoid contact with anyone who has a contagious illness. Also, be sure to inform your healthcare professional if you plan to have any immunizations or vaccinations while using Nelarabine. Be cautious with sharp objects and avoid contact sports to lower your risk of injury while taking this medication. It's also important to inform your doctor or dentist about all the products you use before having any surgery. Nelarabine may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely, and limit your alcohol consumption. If you are using marijuana, be sure to discuss this with your doctor. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks of using Nelarabine. This medication may harm an unborn baby, so it's important to use reliable forms of birth control during treatment. For men using this medication, effective barrier protection should be used during treatment and for 3 months after the last dose. Breastfeeding is not recommended while using this medication, as it is unclear if the drug passes into breast milk. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can affect how your medications work or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so be sure to keep a record of all the products you use and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Nelarabine intravenous solution include other anti-cancer drugs, especially pentostatin. Be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If someone takes too much of this medication and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Make sure to have regular lab and medical tests done, like a complete blood count, while you are using Nelarabine 250 mg per 50 ml intravenous solution Purine Analogues. It's important to keep all your appointments with your doctor and for any lab tests. If you have any questions, consult your doctor for more details. Be sure to take each dose of Nelarabine 250 mg per 50 ml intravenous solution Purine Analogues as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist to establish a new dosing schedule. Do not take a double dose to make up for the missed one. This medication is not for home use, it will be administered in a clinic and should not be kept at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.